The president has received 2 different treatments so far. One is intended to boost his immune system, and the other has shown in trials to reduce recovery time. Fox 4's David Santendry continues our coverage tonight. David.
Yeah, Natalie, both of these treatments received by President Trump are experimental in nature, and only one of them has been approved by the FDA for emergency use. Now, the president's medical team says he was feverish Thursday, heading into Friday. They say he's doing well now, but reporters over at the White House have been receiving conflicting reports about what exactly went down at the White House yesterday. President Trump's medical team addressed the media for the first time since his COVID-19 diagnosis. White House Chief of Staff Mark Meadows says the president went through a very concerning period Friday and that the next 48 hours will be critical, a dramatically different picture than what's being painted by the medical team.
Thursday, he had a mild cough and some nasal congestion and fatigue, all of which are now resolving and improving. It's important to note the president's been fever-free for over 24 hours.
The good news is the president doesn't have a fever, which is great. That's
Dallas physician Dr. James Pinkney wants to hear more from the president's medical team.
A lot of the facts just don't add up from a clinical perspective.
President Trump was given a single dose of a drug Regeneron Pharmaceuticals is testing to supply antibodies to help his immune system fight the virus. The company provides the treatment for compassionate use,
but it doesn't have FDA approvals.
Sources close to the president tell reporters he was given oxygen at the White House Friday before he was transported to Walter Reed. The president's doctors would not confirm that oxygen treatment.
Has he ever been on supplemental oxygen?
Right now, he is not on oxygen.
I know you keep saying right now, but should we read into the fact that he had been previously?
Yesterday and today, he was not on oxygen.
So he has not been on it during his COVID treatment?
He's not on oxygen right now.
President Trump is on the second day of a 5-day dose of the drug remdesivir. It's been approved by the FDA for emergency use and has shown in trials that it cuts down recovery time. It's been reserved for hospitalized patients.
Typically, we only give remdesivir when someone has low oxygen saturations, when the oxygen is dropping, and when they're having a moderate to severe course.
Trials have just started on patients with milder symptoms. One of those trials just started this week in North Texas with patients at Baylor Scott and White.
He had a little cough, he had the fever. More than anything, he's felt run down.
You know, obviously he was more susceptible with all the events that he was going to and the fact that he didn't wear his mask in close proximity.
Doug Deason is the North Texas campaign chair for the president's re-election campaign. Donald Trump Jr. was supposed to headline an event with him in Texas Friday, but had to cancel. Deason believes the president will beat COVID-19 and that it won't hurt his re-election chances.
Nothing gets him down, nothing stops him.
President Trump is 74 years old, and clinically he is listed as obese, which puts him at higher risk for serious complications due to COVID-19. Natalie, back to you.
All right, David Santendry reporting live tonight. Thank you.